This sitting is resumed. Prior to the suspension, this Honourable Chairman was in Standing Finance Committee. We returned to Standing Finance Committee.
This House is in Standing Finance Committee.
Mr. Chairman, Head 86, Ministry of Health and Wellness has amended $257,058,731.
Honourable Member for St. Michael, West Central.
Thank you, Mr. Chairman. Mr. Chairman, I would like to seek leave to join members of the Ministry of Health and Wellness team in the well. And in doing so, sir, I would also like to ask for leave for the Minister of State in the Ministry of Health and Wellness to join us.
So granted, Honourable Member for St. Michael, West Central. Honourable Minister, you may proceed with your opening remarks.
Thank you, Mr. Chairman, and good afternoon. Mr. Chairman, in moving ahead, we wish to set out the broad policy for the allocation of Head 86, but I would also want to introduce members of the ministry's team who will be answering questions. With me is the Minister of State in the Ministry of Health and Wellness, Dr. the Honourable Sonia Brown. Also the Permanent Secretary, the Most Honourable Jeanette Phillips, Dr. the Most Honourable Kenneth George, Chief Medical Officer, Dr. Anton Best, Deputy Chief Medical Officer, Ms. Rashima Cheltenham-Niles, Director of Planning and Research, Ms. Kathy Ann Drayton, Finance Officer, Dr. Ingrid Cumberbatch, Senior Medical Officer of Health, Dr. Arthur Phillips, the Senior Medical Officer of Health, Ms. Francina Banscom, Chief Environmental Health Officer, Mr. Danny Gill, Health Finance Commissioner, Mr. Junior Burgess, Director of Information Systems, and at the institutions we have Mr. David Leacock, Director of the Hospital, Director of the Psychiatric Hospital, Dr. Brian McClacken, Senior Consultant Psychiatrist, Mrs. Heather Payne Drakes, Hospital Manager, Geriatric Hospital, Mrs. Miriam Hines, Director of the Drug Service, Dr. Sanjay Beckles, Director of the Bestos Santos Lab. We also have with us from the Queen Elizabeth Hospital, the Executive Chairman, Mrs. Juliette Bynor Sutherland, Mr. Adrian Hurley, Director of Financial Services, Dr. Clyde Cave, Director of Medical Services, Mrs. Paula Abuga, I believe I pronounced it incorrectly, forgive me if I didn't, Director of Engineering Services, Mrs. Ingrid Caballero, Operations Manager, Harsons Point, Mr. Tony Harris, Director of the National Cardiology Project, and Ms. Louise Bob, Director of Support Services. The request for $342.8 million is broken down as follows. Personal emoluments of $118 million, goods and services of approximately $75.7 million, recurrent transfer $140.9 million, with capital expenditure amounting to $7.8 million. Mr. Chairman, all of these millions only sound good on paper, but can only mean something if we can improve the health of the nation in a way that it positively affects the ordinary man in the street who cannot afford private health care. The Queen Elizabeth Hospital will be a significant priority for my ministry. We will focus on what is achievable and what can be delivered in this coming financial year with a clear understanding of what capital requirements are necessary. On assuming office, I instructed the Executive Chairman of the Queen Elizabeth Hospital to prepare a 5-year capital expenditure program for the ministry's review. The capital expenditure program will involve stakeholder participation to better understand what is needed at the QEH to enhance efficiency and effectiveness. The capital works strategy and plan, along with other critical improvements in hospital quality, human resource planning, improve access to pharmaceuticals, medical technologies, and cardiac care, both pre-hospital and in-hospital care, so as to improve patient care and ensure successful outcomes. Having asked for the information on the most pressing outstanding issues and how they should be prioritized, I have been advised that urgent and immediate action should be given to the correction of a long-standing problem at the hospital, namely the long list of overdue and varied surgical operations that have piled up over the last several years. For example, I've been advised that the waiting list for cataract surgery is in excess of 700 persons. It is, and of course, this is highly acceptable and will be reduced in the shortest possible time. We are currently exploring partnerships to reduce this backlog with the people and government of Cuba. I've already signaled to the Queen Elizabeth Hospital that overdue surgeries will have to be brought up to date. To this end, we are devising plans to address how to reduce this backlog, including out-of-the-box commercial thinking. To do so, we will have to do all we can to get the Lions Eye Care Center up and running to ensure that those on the waiting list who cannot afford to pay for private eye surgeries can have them done at the Queen Elizabeth Hospital free of cost. The time has come for those who work hard to send us to school to help build this country must no longer in their time of need be left in a painful state. The capital expenditure plan will include getting the 12 operating theaters back into full operation.
Currently, 9 theatres are operational, and those responsible will be required to have all 12 theatres working during the day and night. Another example is the backlog of some approximately 1,800 persons waiting for CT scans. We are reviewing options to come up with a quick and satisfactory solution. The overall objective of the Queen Elizabeth Hospital is now execution with precision driven by results. Revised monthly reporting systems will be put in place to measure progress on key deliverables, including surgical wait lists to help inform us on the outcome of what is necessary to achieve the stated objectives. The Ministry of Health and Wellness will continue to aim for the provision of equitable, affordable, quality, and humane health care at primary and tertiary levels. COVID has added yet another layer to healthcare delivery, which, in a short 2 years, has resulted in a paradigm shift in the governance and management of healthcare across all sectors. In the 2022-2023 financial year, the Ministry of Health and Wellness will be supporting the return to improve governance and management of COVID and non-COVID health sectors. As we move away from lockdowns and restrictions of movement to purposeful and progressive opening of our economy, we expect that expenditure will return to pre-COVID levels. In financial year 2022-23, the Ministry of Health and Wellness will transition from a COVID-centered healthcare response to one that embraces all aspects of healthcare. I've already signaled that primary healthcare, environmental health, mental health reform, access to essential pharmaceuticals and vaccines, HIV/AIDS, climate change, disaster preparedness, and non-communicable disease will be our non-COVID focus. However, our mandate does not stop there. We will be forging ahead forward by providing better working conditions in terms of engagement for nurses, doctors, supporting and ancillary staff. We have listened to the concerns of the nurses through their respective trade unions and have already taken proactive steps, including appointments, payment of overtime, and better physical working conditions. We will further strengthen our relationships with our regional and international partners, including the Pan American Health Organization, the Health Economics Unit at St. Augustine campus of the University of the West Indies, the Caribbean Regional Public Health Agency, CARPHA, to tackle the complex issues as healthcare financing, human resource for health care, and child obesity. I believe that, particularly in the time of COVID, we must redouble our efforts so as to provide complete and accessible health care to the elderly and persons with NCDs. In addition, our partnerships with the Heart and Stroke Foundation, the Barbados Diabetes Foundation, and the Barbados Family Planning Association, and the University of the West Indies will continue. We are grateful for the partnerships formed through the cordial and productive relationships with the government and people of Ghana and Cuba, particularly in support of nursing services in Barbados. The government of China has offered their continuing support to the Queen Elizabeth Hospital by providing technical, medical, and surgical disciplines to assist in the improvement of patient care. And the Ministry of Health and Wellness will continue to forge partnerships with Ross and Chamberlain universities. We will continue to safeguard the professionals that deliver health care by ensuring that the councils which govern all professional bodies are given the resources to perform their statutory functions. Some of the specific deliverables for the coming financial year will include the reintroduction of the stipend for nurses funded to the tune of $2 million, incentivizing the population to choose careers in nursing. Improvements in cardiac care, both pre-hospital and hospital care, in-hospital care. Reconfiguration of the Queen Elizabeth Hospital to facilitate the relocation of the outpatient clinic and administrative offices to create additional clinical space at the Queen Elizabeth Hospital. Supporting the construction of a new geriatric facility at the Botanical Gardens, piloting the introduction of a tissue and organ transplant bill into Parliament, and completing renovations of the St. Thomas Outpatient Clinic, as well as advising on blueprint for the Alzheimer's respite facility at the Gordon Cummins Hospital. In a revenue-constrained environment, I will be requiring all department heads to pay special and close attention to how funds are used and allocated as we manage our healthcare system. I take this opportunity to mention two areas which, in my view, have the potential for revenue generation. These are the Best of Santos Public Health Lab and Harrison's Point. As we slowly transition out of the COVID environment, the opportunity for income generation by Best of Santos and Harrison's Point will be fully explored. As I indicated approximately 2 weeks ago, healthcare is fast becoming a major sector for employment, not only for nurses, but biomedical technicians and engineers, radiographers, radiotherapists, ultrasound technicians, and other specialist ancillary staff, with millions being invested in private sector in private healthcare in Barbados. The time for persons to commence training is now to take advantage of those expanding healthcare employment opportunities that will arise when healthcare investment projects materialize. Overall, the ministry's ambitious program will result in enhanced healthcare delivery, strategies to combat non-communicable diseases to help lower healthcare costs in the medium to long term, health promotion, new models for healthcare delivery and financing, employment opportunities when healthcare investment projects come on stream, modern mental health strategies, improve environmental monitoring and regulating, maintenance of pharmaceutical costs on quality and pricing to sustain the drug service, and maintaining vital and critical lab services that did us so proud during the COVID-19 pandemic. Let me once again thank all workers involved in the COVID response. And mindful of the role of a ministry, we will continue to work with our partners to ensure Barbados' healthcare institutions are upgraded and expanded. Thank you, Mr. Chairman.
Honourable Minister, could you please move ahead?
Mr. Chairman, I beg to move that Head 86 stand part.
Wait a second, sir.
At this time, we will proceed with questions from the dishonorable chamber. However, before we do so, just for the benefit of your team, Minister, let me just outline the basic rules. As you know, Minister, you would have 5 minutes to respond to any questions raised. Members of your team would have 3 minutes to do the same, to respond as well. And I would also ask that when you are about to address, before you address the particular question, this is for the members of the team or public servants, please give your name and the particular area or your particular office that you are in. Just give your name for the records of this house. Thank you. Honourable Member for St. Michael West.
Thank you, Chair. Good afternoon to the Honourable Ministers and Ministry officials. First and foremost, I would like to congratulate the Honourable Ministers on your appointments to a very important ministry. I would also like to express my appreciation for the stellar leadership of your predecessor, the Most Honourable Lieutenant Colonel Jeffrey Bostick. In that vein, our former honorable comrade coined the phrase, "No retreat, no surrender," to describe our resolve in the fight against COVID-19. On inspection of your estimates, it is clear that from subheading 366, that the focus will change from COVID-19 to NCDs, as that pandemic is more going towards endemicity. According to a report by the Barbados National Registry, heart attacks and strokes were the leading cause of death in 2019 in Barbados, and presumably that persists today. Now, also a study done by University of West Indies Chronic Disease Research Center, Barbados has the second highest incidence of amputations in the world at 76 per 100,000. In keeping with the military parlance of our former honorary brother, this phenomenon must then be described as the enemy within. Honorable Ministers, can you articulate the plan to fight this sleeping enemy which is already within our borders?
Thank you, Honourable Member. And of course, I would have commended my predecessor and all the work that he would have done in the ministry in my very first outing as a media briefing as a minister, and I do so again today. In respect of NCDs, you're quite right. The Prime Minister, in constructing her cabinet, appointed a Minister of State within the ministry, and in so doing, the Prime Minister indicated that a significant focus must be in the ministry in this term, must be on NCDs, non-communicable diseases. We are fortunate that we have a medical doctor, Dr. Sonia Brown, as a minister in the ministry, and we also have with us a team of professionals who have been working with us for a long time and who continue to guide the ministry in respect of NCDs. I do agree that the rate of amputation is a serious matter for engagement as it is for concern. And I can tell you that we had exploratory talks with other officials to address the issue of how best we can save limbs. I'm not a medical doctor, and therefore I can't speak as fluently as I would like to on the issue. But what I can tell you is that it has engaged the attention of the ministry, and since joining the ministry, both ministers have been engaged in discussions, exploratory discussions with others. At this point, what I would like to do, as Dr. Sonia Brown, the Minister of State in the ministry, will be leading this charge, I would give her an opportunity to speak, and thereafter, in respect of the issues surrounding the cardiac approach, I will ask Mr. Tony Harris to speak to us as well. And in respect of the other matters, I believe that Dr. Arthur Phillips will also be in a position to address matters pertaining to the NCDs. Minister.
Thank you, Chair. Thank you, Minister. Since we have other members speaking, but I want to say, of course, my 2 cents worth. Yes, COVID has succeeded in putting the NCDs issues on the back burner or middle burner, as it were. And as you said, quite rightly, we are now moving forward in addressing the matters with the NCDs. We are not proud that we're considered the capital of amputations in the world, but this is where we now see that the focus monetarily, financially, has to be placed on the primary care setting where we address the NCDs at an early stage. That being said, it would include the involvement of all sectors in society, perhaps starting with the school-age children, probably before school age, as I said in another forum, where it involves the education and the input of the players, whether it be parents, students, the players that matter in terms of the companies that produce beverages, sweetened beverages, where it be a matter of the school meals department, which the nutrition center liaises with to address the feeding patterns and the nutritional status of students. And I may say COVID has succeeded in seeing that we have increased numbers of underweight students and malnourished children, especially under 5s, and that's where the National Nutrition Center comes in. I also want to hasten to add that the NCD fight has to involve not only the Ministry of Health and Wellness, but almost all of the other ministries represented by those in front of you now, Mr. Chair. So we need involvement not only from the Ministry of Education, as alluded to earlier, but the ministries that one would not necessarily think of with respect to the NCD fight. So, for instance, the Ministry of Transport and Works, we need to be a little more progressive, and I addressed this 2 days ago, where we need the involvement of the Ministry of Transport and Works with respect to walking paths, with respect to sidewalks, with respect to accessibility, basically to exercise. It will involve the National Conservation Commission with respect to our parks. It spans a very broad, across almost all the ministries. We need to tackle the issues like labeling of packages, and one of our neighbors had succeeded in doing so, demanding that packages be labeled. We need to, town and country planning, for instance, needs to address the location of fast food outlets, for instance. We've come to see that many of the fast food outlets have been located right next to or in close proximity to some of these schools. These are some of the areas that we need to address with respect to NCDs. But as I said before, the focus financially has to be on the primary care setting. This decreases the burden on the tertiary care settings, because if we could control the occurrence of NCDs, some of it you can't help in terms of genetics, but some of it you can. Obesity needs to be addressed. The control or the prevention of diabetes needs to be addressed in the primary care setting. And this would be aided by the 9 polyclinics which we have, and the outpatient clinics, of course, where pre-COVID, these were the centers for addressing the NCDs firsthand, foremost. The hypertensives, the diabetics were usually well controlled or fairly well controlled at this end, but COVID have put a damper on their efforts, and it's my mission and the Ministry of Health and Wellness to see that this becomes the forefront issue. At this point, I want to hand over, first of all, to Dr. Arthur Phillips to give you a little more information on the NCDs. Thank you.
Thank you. I'm grateful to the ministers for Arthur Phillips, Senior Medical Officer of Health NCDs. Grateful to the ministers for laying the context for the fight against NCDs. And this indeed is one of our key issues that we need to address, as it is a leading cause of death and illness, and affects productivity across sectors. So the issue of general prevention, I think, has been outlined. The issue of diabetes management, I think, is absolutely key. Individuals who have diabetes need to know that they have diabetes, and that diabetes needs to be managed well. So there need to be up-to-date clinical guidelines, there need to be training on those guidelines, there needs to be auditing around general diabetes control, as well as issues around foot care and wound care in that context. Where individuals already have issues in terms of their peripheral nervous system and vasculature, then there's need for additional intervention in terms of ensuring that there's access to podiatry and other aspects of supportive care, as well as wound care, to reduce the chance of amputation. In some cases, revascularization will be possible and will reduce the risk of amputation. In some cases, people will need adaptations to their footwear to, again, reduce the chance. So there's prevention at each step of the way: prevention of persons developing NTDs, prevention of diabetes being out of control, prevention of complications to the feet resulting in amputations. And all of this is part of our effort to continue to ensure that appropriate care is available in both public and private sectors to all persons in Barbados. So the issue of amputations is something that that we are actively looking at, and our current diabetes guidelines speak to it, but we're going to continue to reinforce in terms of training and auditing to ensure that appropriate care is given. In terms of the wider policy context, the NCD strategic plan, we've just updated the statistics, and this is going to be resubmitted to Cabinet shortly. It's being formatted at the moment. So this is going to speak to all of the issues that we address in terms of risk factor reduction, treatment of NCDs, within which the issue of amputation falls, childhood obesity prevention, which Minister Brown mentioned, coordinating with all the various players in the public and private and civil society sectors, resource mobilization and allocation, because it is not inexpensive to manage NCDs, and the proportion of funds that have gone to preventive efforts has traditionally been very, very small. in some cases less than 1%. So there's a lot that we have to do, but we have clear plans, and there is a commitment to ensure that the resources are available and that we monitor to make sure that we are achieving our goals. Thank you.
Ms. Harris, you want to weigh in as well?
Good afternoon to the Honourable Chamber. Good afternoon to the ministers, Mr. Goodinechil and Dr. Brown. It's on, isn't it? Yes. Thank you very much for the chance to speak on this. Certainly, as you know, we are conducting a improvement plan for cardiac care as it relates to acute myocardial infarction, and we have made tremendous progress in this.
Mr. Director, could you please give your
Yes,
name?
my name is Mr. Anthony Harris. I am on special assignment for in the project for the reduction of mortality in acute myocardial infarction. Sorry about that, but as I was saying, we are conducting that exercise. We have done a number of things. As you may be aware, the government of Barbados has established a national registry with CDRC, UWI, for the conduct of a national registry in 3 topics, there being acute myocardial infarction, stroke, and cancer. So we have been working closely with them to ensure that we have reliability and rapid access to the data, and using this to guide us and to ensure that going forward we can chart and demonstrate our improvements in these areas as we put measures in place. We have also looked at the emergency ambulance service, had a series of meetings with them, also established training programs for the care of the patient with acute myocardial infarction. We have done a number of improvements, or there have been a number of improvements with this service. The Barbadian public may not be fully aware, but the ambulances are now equipped with cardiac monitors that allow the transfer of data from the field directly to the Queen Elizabeth Hospital, particularly at 2 points, that being the accident and emergency department and the cardiac unit at the hospital. We have also been encouraging private ambulance to these meetings, ensure their training, so that all Barbadians, those using the private service or the public service, would benefit from these improvements. This has been successful. During the last financial year, the government has provided us with the resources and funds to allow for the purchase as well of what are called autopulses that allow for resuscitation of patients in a moving ambulance. And this, we believe, will be also significant to improving care and ensuring patients get to the hospital alive. A lot of patients were coming to the hospital only pronounced dead on arrival. We are also have to tackle the whole notion that the ambulance is the reliable service to use, and to try to discourage patients from bringing their relatives to the Queen of Hospital in private vehicles, but trust that the ambulance service will be readily respond and be able to perform their duties for ensuring that these patients do arrive at the hospital alive. We have also done a number of exercises within the Queen Elizabeth Hospital. The cardiovascular department, the interventional cardiologist, Dr. Don Scanterbury, has been working closely with the accident and emergency in her department to ensure that the care of patients who present with heart attack is of a first world nature, and that the patients are getting the best care that they can. To it's important that when a patient comes with an acute myocardial infarction in progress, that little time is lost in opening and revascularizing that patient. At the Queen Elizabeth Hospital at present, this is done predominantly by a thrombolytic process. That is a so-called clot busting exercise that we have, but it is not very useful if several hours pass. And therefore, we are trying to hone everything such that the patient can be managed and treated and is executed within those magic window of 3 hours. And with that, if we can do that, not only are lives saved, but long-term morbidity, heart failure and stuff, which is a rising burden at the Queen Elizabeth Hospital, can be prevented, as most of your myocardium, or nearly all of your myocardium, will be saved, and therefore your heart can continue to function normally. We are at the point now, COVID has kind of put this on the back burner. That was that we need to start a public education drive, but we thought that with the flurry of health information coming because of COVID, it probably would be a little overwhelming, and also we would be subsumed by the amount of COVID-related information. But in this era going forward, we certainly is going to pick it back up, that we are going to be pushing the ensuring that the public does know what is available, how best to utilize it, how they can help, and how they can help prevent, play their role in prevention of more death and morbidity, long-term morbidity problems. I believe I was informed that we have 3 minutes. I think that is basically it. But I would just like to touch briefly on the amputation aspects as well. At the Queen Elizabeth Hospital, this has been something that has been concerning us for some time. And a few years ago, we had been looking at training. As the Minister mentioned, we have had technical assistance in medical field from the Republic of China, and they have also brought some interventionalists and vascular surgeons. And we are looking forward to the return of a freshly trained and minted vascular surgeon, Dr. Nina Yap, who will also lead revascularization drive to help prevent and reduce amputation at the Queen Elizabeth Hospital. But of course, the vascular destroying conditions of diabetes and hypertension have to be tackled up front if we are going to see a sustained reduction in that. Thank you very much.
Yeah, Mr. Chairman, I would also like to add that the ongoing works with the Barbados Diabetes Foundation. The Barbados Diabetes Foundation, we had the honor of meeting with them during the short 4 weeks we've been in office, and they too continue to perform and serve not only the Barbadian public, but certainly the region in executing their mandate to assist us with the control and risk factors associated with diabetes. Within the ministry as well, there's a health promotion unit, and I'm pleased to let you know that the health promotion unit will continue to educate Barbadians about healthy eating, about lifestyle management and changes to their lifestyles. Nutrition policy will also feature very prominently during the forthcoming financial year, because it is our wish to execute and implement the national, the NCD plan that Minister Brown will be leading, Dr. Brown will be leading on our behalf. And therefore, I can give you the assurance that we will continue to work with all of those partners. Lastly, there's also a lot of work being done by the George Allen Chronic Disease Center. That center continues to, provide the Ministry of Health and certainly Queen Elizabeth Hospital with a lot of research. And that research information will go a long way in allowing us to devise and revise critical strategic plans as we launch our NCD drive.
and we met with Professor Simon Anderson, I believe I recall that's his name, early in the stages of our appointment, and he has also given his perspective and the perspective of the George Allen Chronic Disease Center. So we'll be working with all those institutions as we craft a national plan for NCDs, and supporting that by leading, working with the task force and the commissions that we've set up to drive that process forward. Thank you, Mr. Chairman.
Okay, Mr. Chair, this is not a second question, but just a comment. I'm not sure if public access to defibrillators, as is common in the US, can help, especially with cardiac situations, but maybe that is something that the ministry can look at as well. Now, to my second question. As I have canvassed and traversed the constituency of St. Michael West, I do encounter lots of constituents who have expressed frustration with the long waiting lists for surgical and non-surgical procedures on an outpatient basis. Now, as Barbados seeks to become world-class in the delivery of services across the public sector, as stated by the Honourable Prime Minister, and as we engage as a government in facilitating growth in our economy, it follows that the health of our populace is tantamount to these goals, as productivity in the workforce will be key. Now, I heard the Honourable Minister's comments in his opening statement in terms of beefing up the capacity to treat or to beef up the surgery and non-surgical procedures. In one instance, I think the minister alluded to using the Cuban doctors, and I want to publicly express my appreciation for those Cuban doctors and nurses who have also helped us with our COVID-19 pandemic. But I think that we also have to look at the issue of the bottlenecks with resources, specifically supplies. Now, I am aware that some surgeons and doctors, specifically at the QEH, have pulled their own pockets to purchase supplies in the interest of performing these surgeries. So I think that that also needs to be urgently addressed. Can the ministers address these issues? Thank you.
Thank you. Thank you, Honourable Member. I think it's safe to say that, and based on my very brief stint thus far at the ministry, that the Queen Elizabeth Hospital, as I indicated, will become a top priority for my ministry. But I would also like to caution that the Queen Elizabeth Hospital's budget is not where it ought to be, and we understand why. We are coming out of the throes of a pandemic. Government revenues, especially from the productive sectors, would have been reduced, and therefore the government can only transfer so much money to the Queen Elizabeth Hospital. As you will note in the estimates, that we have made a provision for the transfer to the Queen Elizabeth Hospital. Now, we have to deal with a lot of the issues. The issue that I raised earlier had to do with a capital plan. In order for the hospital to reduce its recurrent expenditure, it will have to go the route of increasing its capital expenditure. Now, the government, in coming to office back in 2018, would have allocated and spent approximately $18 million to assist the hospital with its capital expenditure. Now, that went a long way, but it didn't go far enough, and therefore what we are discussing is looking at a capital expenditure program that would certainly reduce the cost of doing business currently at the hospital. It would save us key expenditure in key areas now that we either have to outsource or we have to patch and repair. But it would also allow the Queen Elizabeth Hospital to to get the necessary equipment that it needs in order to enhance patient care and delivery. And until we reach that point, and I know that we're going to get there in short time, once we have that capital expenditure plan, like I said in my opening remarks, we are going to discuss and involve all stakeholders. But we're also going to, as ministers, we are going to walk the Queen Elizabeth Hospital to also look and see the priorities and the ranking list. And once we get that, then we'll be in a better position to start the process. In respect of the waiting list for surgeries, and I alluded to part of that in my opening remarks, it is a problem. And it is a problem that we're going to have to fix in the shortest possible time. We can't get everything fixed within 1 year or 2 years. But certainly, there are some quick initiatives that I think we can implement, provided we have capital expenditure to do what we have to do. And once we do so, I think we will start to see a reduction in the backlog of surgical and non-surgical procedures. Like you, I've heard from my constituents in St. Michael West Central as well, who commented on sometimes having to go and having to wait or to come back. And I came to the ministry with a very open mind, but a very clear position that we have to work together with the Queen Elizabeth Hospital and with all the related parties at the Queen Elizabeth Hospital to address this issue. But I think, in fairness, we also have to start addressing not only capital equipment issues, we also have to address issues regarding the processes that are currently engaged at the hospital and see how best we can improve those processes to enhance patient delivery and patient care. And I think that we are going to see, in the shortest possible time, an improvement. The fact that I was able to tell you this afternoon that we have in excess of 700 persons waiting for cataract surgery is a clear indication that we've gone to work as ministers within the ministry, and we're asking for the information to better plan. So once we have that information in front of us and we know what is required, we will go to work. Like I said, we are also exploring additional opportunities with agencies abroad and also with governments who've been working with us to see if we can enhance our patient delivery. And it will take some time, but the clear signal I want to send to the country that the ministry will be very focused on the whole issue of the wait lists as it relates to surgical procedures in Barbados, and that we are going to devise a plan to address the issue of backlog. And when we've reached that point, we will then message it and communicate with the public to let them know what we intend to do. And like I said in my remarks, opening remarks, we are going to measure it so that at any point we'll be in a position to ask the Queen Elizabeth Hospital, if you said you had 700 cases waiting for cataract surgery, for example, at a defined period, how many cases have you completed? And the Lions Eye Care Center as well, we're going to have to spend some money to refurbish that. And if we refurbish that, then we can take some of the pressure off the other operating theaters. I believe, and the Queen Elizabeth Executive Chair can comment on this, that we have maybe an opportunity to maybe have maybe 3 or more theaters within the Lions Eye Care Center to do perform critical surgeries. So if we can get that back into operation, equipped and staff, and also utilize other areas, for example, get the operating theaters back up to the required 12, I think it'd be a wonderful opportunity for us to address these issues. So I can assure you, Honourable Member and other members and the public at large, that we will be working extraordinarily hard to address the issue of the wait lists as well as the outstanding numbers that are waiting for key surgeries. And like I say, it's not only limited to cataract surgery. I use that as one example. I've been advised that there are other areas where there's a wait list, but we will work to combat that. I don't, Minister Brown, if you wish to add that.
Thanks, Chair. Quickly, what I do agree with the Honourable Minister with respect to the CapEx plans, but I want to allude a little bit more so for the public. in terms of where we want to direct some of these issues. As the Minister said before, the Lions Eye Care Center, that is badly in need of repair generally, but also the theaters. So this would free up 3 theaters. One of the issues we want to address, at least in speaking with the staff, is making the theaters, and they are not so now, a 24-hour operation more or less. Right now, the theaters operate on a 8 to 4:30 basis. What needs to happen is that we need to extend the operating hours for longer. We just hired a new chief operations officer, and she has been given some good ideas with respect to the way forward to get rid of some of the backlog for the surgeries. And in a sense, we are hoping to get some financing from externally so that the hospital can not only service public patients, but increase the private patients coming in that will add to the intake of the hospital, so that it becomes also a money-making institution. There are internal matters with respect to the surgeries as well, and sometimes it's probably a cultural issue with respect to the surgeries. Simple things that would not require capex would be like getting the surgeries to start on time. We also need theater staff, and like everywhere else, COVID had pulled away a lot of the staff from the hospital to service the other COVID areas. So with the closing down of some of the isolation facilities or quarantine facilities, staff should be coming back to the hospital. But people have mentioned things like a pre-anesthetic clinic, which would make the surgeries go a little faster. I know, Honourable Member, one of the things you may have heard, things like joint replacement surgeries, obstetrics, not so much obstetrics, gynecological surgeries that have been on the back burner, but a lot of these reasons are because the theaters are not functioning as efficiently as they should. So we go forward, Minister and I, in trying to find solutions to the issue, apart from the Cuban doctors coming in. We know for pediatric, I think they are aided by external sources as well in terms of the pediatric surgeries. We have to look at getting technical assistance in some areas. Orthopedic surgery is one of them. And I was a little bit taken back yesterday when I heard that the orthopedics, in terms of joint replacements were not done for a while. One of the reasons being the absence of trained technical staff. So we have to move forward in terms of nursing staff, in terms of training and getting this back up and running. So that's just my take on that part of the backlog for surgeries.
Thank you, Minister. I will ask just briefly the Executive Chairman of the Queen Elizabeth Hospital just to report on the issue in respect of any backlog surgeries.
Thank you. Both ministers have spoken so eloquently on the issues in such a short space of time. The only thing I can add is that this issue of delays in surgery.
Madam Chair, would you please?
Sorry, my apologies, Honourable Member for St. Lucie, Chair. Juliet Bino Sutherland, Executive Chairperson, Queen Elizabeth Hospital. Thank you. The only thing I'm going to add is that what a particular intervention that we're going to be doing is to really introduce the use of data and matrices to better look at what we do. The best way in which we can measure, as the Honourable Minister Gooding-Edgell has said, our performance is if we're adequately measuring. Currently, we do not have adequate systems for measuring the reasons and the delays for surgeries. So it is, or adding to the additional remarks of our ministers, we're going to be entering into a special project where we're going to survey over a period of time the reasons for the actual delays in surgeries. Some of them will be late arrival of surgeons. Some of them will be late arrival of patients from the ward. Some of them will be the turnaround times between cases. Some of them will be other internal inefficiencies. Once we're able to target and identify the exact causes, we're then able to talk to individual surgeons, talk to individual teams with precise data on exactly what has happened, and you move beyond the issue of anecdote to the actual issue of performance-based management. So what both of our ministers are encouraging us to do is to deepen our response in this regard, and certainly the recruitment of a COO who would have had this assignment at Metropolitan Hospital of moving that hospital from being number 12 in New York Health and Hospital System to number 1, certainly will go far towards identifying a resource person to provide the necessary leadership and team building and capacity support in order for us to reach these goals.
Yeah, and Mr. Chairman, just quickly to let you know that as documented in the amended estimates, this year the Queen Elizabeth Hospital will benefit from the transfer from central government to the tune of 125 million. I believe last year that we would have been 120 million would be transferred. So the government has increased the transfer to the Queen Elizabeth Hospital in the forthcoming financial year by some $5 million. And like I said as well, we are going to be exploring other areas of financing for our capital expenditure so we can retool and re-equip the Queen Elizabeth Hospital. But I want to put the caution out there. We can't do everything in 1 year, 2 years, or 3 years because our resources wouldn't allow it. And as government revenues improve, I'm sure that the Ministry of Finance will continue, as they do, look favorably at the Queen Elizabeth Hospital to see how best they can assist us in improving the operations there. I just thought I'll share that with you, Mr. Chairman.
Thank you, Honourable Ministers, for that assurance, and thank you to the Executive Chair. I look forward to continued improvement in this area. Now, for my third question, which hits a little bit close to home, I have recently had a loved one face the terror of a breast cancer diagnosis. And as we all are aware, our sister, the Honourable Acting Prime Minister, also faced this horrific disease. Even though awareness is heightened, especially during Breast Cancer Month, which I think is in the month of October, many of our Barbadian women are not subjecting themselves to regular screenings. Now, I want to take this opportunity to thank the Barbados Cancer Society for its tremendous work in this area, especially with its breast cancer screening program. But in being intimately involved with this disease, I became aware through that very organization that survival rates in this country, our beloved country, sits at 40%. Now, as I said earlier, as we seek to become world class, I find this somewhat unacceptable. Now, for context, if we were to compare the survival rates in the US and Canada, they sit at 90%. And we're losing way too many sisters in this country. This is mothers and grandmothers. And we must bridge this gap somehow. I would like to add that the Honourable Member from St. Michael South Central would tell you that our women are already underwater as they are disproportionately affected negatively from the COVID-19 pandemic. So as against this backdrop, we can't allow them to suffer anymore. Can the ministry articulate a strategy plan that we can bridge this divide and bring us to world-class statistics?
Thank you very much, Honourable Member, and I empathize with you. I
unfortunately lost my mother due to breast cancer as well when I was 14 years of age. And I understand the tremendous pain that, families who lost their loved ones when they succumb to cancer. So I fully empathize with those who would have had either a survivor and or a loved one who would have passed as a result of cancer. Breast cancer, like all others, constitute a major risk factor that we're going to have to investigate, and we will have to work closely with all research in order to understand what's happening out there to better inform our approaches to the management of cancer. The ministry is currently working, and certainly an investor had approached the ministry to undertake an investment opportunity to have a cancer clinic in Barbados. We are not at an advanced stage, but we are due to meet with the investor over the next week, and we will have a greater understanding. And obviously, any investment in cancer research and or management of cancer will be welcomed by the ministry and certainly by the government of Barbados. What I would like to do is ask Dr. Arthur Phillips to respond to you as well. He has done, and it's under his responsibility, he's done some work in this area. Dr. Arthur Phillips.
Thank you, Minister. Thank you, Chair. Breast cancer is one of our leading causes of death from cancers in Barbados. In women, it is in close competition with colorectal cancers. In men, of course, prostate cancer is a leading cause of death. In terms of breast cancer, in terms of cancers more generally, our approach is a holistic approach. It's an approach that starts with prevention, including public education, including screening, and of course includes access to effective treatments. We have engaged our colleagues at the University of the West Indies. We would have mentioned our engagement with colleagues on the research side in terms of the Barbados National Registry. And as we mentioned, they provide us with accurate information on the burden of the major chronic diseases, particularly cardiovascular and cancers, as well as factors around when people are presenting and issues around the risk factors for severity of disease. Additionally, we have engaged colleagues at UE to assist us in developing appropriate local guidelines for screening and early detection of cancers, including breast cancer, because the issues around self-examination, the issues around regular examination by a healthcare provider, mammograms, and appropriate biopsy of lumps and removal of suspicious or lesions that are known to be malignant is all part of the package. So we believe that the approach that we are taking in, one, having the data around what is actually happening, and two, ensuring that we have appropriate guidelines, and three, ensuring that we continue to measure and monitor to ensure that we have appropriate outcomes, that this approach, as applicable to cancer prevention and treatment, will bring continued benefits in terms of our breast cancer management approach. Thank you.
Minister Brown.
Yes, I just wanted to add to what Dr. Phillips is saying. Education has to be a big part of it with respect to cancer screening. We are doing quite well, I think, in terms of the opportunity to be screened in Barbados with respect to cancer. We have the cancer support services that follow on to cancer. We have the Cancer Society. We have a few other private institutions that do breast screening. One of the issues we have in Barbados is the education lack of, or the miseducation of women and men with respect to breast cancer. So there's always an ongoing debate with healthcare professionals, with the patients, whether it is safe to do mammograms. These are some of the issues we have to address. People are still scared to do mammograms. A lot of them think that they give you cancer. As Dr. Phillips says, there is also a debate ongoing. Now we see in some of the more developed countries, US, they're not advocating necessarily self-examination, whereas the surgeons here, and I agree with them, still advocate for breast self-examination. So education is a big part of it, in getting our women to understand the impact of breast cancer. From a young age, people still have the view that cancers come on as you're aging, but we all know that we're meeting some young people in their 20s that have had to have mastectomies and so on for breast cancer. So, and being, this is also part of the NCDs. People tend to forget that cancer is considered an NCD. So the fight will go on in this ministry to see where we can improve such measures, but you're right in that screening is definitely important, and the follow-up to screening. Right now, there will be staffing issues with respect to the oncology department at QEH. We're now seeing almost the exit of the chief oncologist there, so it's a matter of having somebody to fill his space. In terms of treatment, we have to look at the availability or the access to PET scans in the public community. Well, social services will be there. But these are things that the ministry, I'm sure, will tackle in the coming years. Thank you. That's it.
Thank you, Mr. Chair. I beg to move that you do not report progress to His Honor the Speaker, and beg for leave to sit again.
Second that, sir.
The question is that I do now report progress to His Honor the Speaker, and ask for leave to sit again. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
The Chairman has reported progress and requests leave to sit again. Honourable Leader, Government Business.
Thank you, Mr. Speaker. I beg to move the suspension of the House until 2:45 p.m.
The second that, sir.
Question is that this Honourable Chamber be suspended until 2:45 p.m. All those honourable members in favour, please say aye. Those against, please say no. We think the ayes have it. This Honourable Chamber stands suspended until 2:45 p.m.